she up and up to love without the condom, you not do no walk. No girl, don't bother play shy. Tell your guy, don't be a back cry. No, no, no. No watch the pretty smile. Remember the hate will take your life. Yes, now we play this one can't get man. I predict it might be me next number one. Reaching out to teenagers, woman and man. When having sex, use protection. Them say one man to one woman that now one again, so take precaution. Condom can save your life. Men, use it with all your wife. Yes, and when she up and come, tell her without the condom, you're not gonna walk. No girl, don't bother play shy. Tell your guy, don't be a back cry. No, no, no. No watch the pretty smile. Remember the hate will take your life. It no matter where you live or who you are. Could have be a millionaire or a movie star. We all are one, so make we sit down and talking and talking. Don't you dare laugh. Every day them say that me a terrible. So check yourself before you wreck yourself. No matter move like Mantel or the glass can tell. See if it divorce and just go to hell. Condom can save your life. Men, use it with all your wife. Yes, all when she up and come to love without the condom, you're not gonna walk. No girl, don't bother play shy. Tell the guy, don't be a back cry. No, no, no. Don't watch the pretty smile. Remember the hate will take your life. Instead of saying, if you didn't know, go pick up your condom. Adigana so. Nobody's easy. The world now feel low. No make safe the hardest. Your name and best down from Oprah show. Men, how would you feel if you get it better long wheel? The wicked Islam, they make your papa wheel. If you find out, so you get your disease. You know I know, so get your condom, please. Condom can save your life. Men, use it with all your wife, yes. And when she up and come to love, without the condom, you're not gonna walk. No girl, don't bother play shy. Tell the guy, don't fear back cry. No, no, no. Don't watch the pretty smile. Remember the hate will take your life. Some critics say that I am a sex machine. They don't know about that, but this I must reveal. If my man just put on it pass, if I will be able to tell Lisa thanks. When he come to me, I am serious. Take me pops never me, you tell check out. Everything fall back in line. If him go where him condom, him not get no blind. Condom can save your life. Men, use it with all your wife, yes. And when she up and come to love without the condom, you're not gonna walk. No girl, don't bother play shy. Tell the guy, don't fear back cry. No, no, no. Don't watch him with the smile. Remember the hate. Amen, amen, amen. And that's all I'm going to say about that song. Amen. Okay, so good morning. Welcome to another Saturday morning, my friends at Esther Ministries. My name is Pastor Jendi, and I am an HIV and AIDS educator in the Channels of Hope program of AIDS Link International. And so every second and fourth Saturday, we provide information and do teachings on HIV and AIDS. Amen. So today, I just want to welcome you one and all to this information session on HIV and AIDS. Feel free to join us and leave your comments. Also, if you have any questions, feel free to leave those questions as well. So today, our topic is the types of HIV tests. Now, I know sometimes persons are afraid of getting their HIV tests done because they feel it might be painful. But there's really nothing to fear about getting your HIV test done. It's very important that you know your HIV status. And if you are in a relationship, it's also important that both you and your partner are aware of your HIV status. Amen? Okay, so there are different types of tests that can be used if a person is HIV positive or to detect if you're HIV positive. So two of these tests are what we call the rapid tests and the
ELISA test. All right. So they're very different in terms of what they look for. So the ELISA test actually tests for the presence of the HIV virus in the blood, while the rapid tests, otherwise called the antibody test, tests for the presence of antibodies that are specific to the HIV virus. Right? So one tests for antibodies, the other tests for the actual presence of the virus. And personally, I have done both tests. Last year I did the antibody test, and it was really quick and easy. So I went to the clinic, and it's testing the same way you would test for diabetes. It's just a finger prick, and then that little blood they put on the card, and within 15 minutes, you know what your status is. So it's very quick, it's very simple, it's very easy. The ELISA test that tests for the presence of the virus is a little more expensive, so it's not generally done at the centers. The rapid tests, antibody tests are free. And I think to some degree at some centers you can actually get the ELISA test for free, but it requires a lot more. You will have to give a sample of your blood, and then you'll have to wait possibly for a few weeks to find out what the results are, right? So we're going to talk about the rapid test, which is generally done at all the health centers, hospitals. You go and tell them that you want to test for HIV, and you'll do the rapid test. Now, the rapid test, like I stated earlier, tests for antibodies to the HIV virus. And antibodies are basically, okay, so antibodies are specific to the type of virus that is in the body. So if you have flu, for example, you would have your immune system that fights diseases in your body would create antibodies that are specific to the flu virus, right? So you'd have flu antibodies. If you have, say, gonorrhea, then the immune system would produce specific white blood cells that would kill this gonorrhea. So they would produce antibodies that are specific to gonorrhea to kill it, right? If you have, say, malaria, then, or you have syphilis, then your immune system would create specific white blood cells to kill the syphilis virus in the body. So the antibodies are created specifically for the virus that is present in the body. So the rapid tests for the antibodies that are specific to the HIV virus in the body, right? I need you to understand that. So if you do not have HIV and you do a rapid test, then it will produce a negative result, stating that there are no HIV antibodies, or there are no antibodies that are specific to the HIV virus in the body, right? Now, if you are HIV positive and you go to do an antibody test and it returns positive, what that test is saying is that we have found antibodies that are specific to the HIV virus. And antibodies are only produced when the virus is present. So once you have the antibody, you know that the virus is present in the body. Amen? All right. So that's the rapid test. It's very quick, very simple. Within 15 minutes, you know your status. For the ELISA test, however, these are, blood samples that you have to take, that they'll take from you, and then you'll have to wait for a few weeks to know what those results are. But ELISA is a viral load test. So viral load tests test for the presence of the virus in the body, right? And you'll understand a lot more about that when we are talking about the window period in the stages of HIV and AIDS. So when we're discussing the window period, you'll understand how important those tests are. So different tests are used based on the scenario and situation, right? So if you go to do an antibody test at your health center and it returns negative, then it's very important that 3 months later you go to do another antibody test. And the reason for that is because depending on the virus in the body, the antibodies may take longer to develop. So, for example, the flu virus, I mean, almost everyone in the world has caught flu at some point or another in their lives. When you have the flu virus, generally it lasts for, a few days or at most a week, because the antibodies to the flu virus are created very fast in the body. So within a week, your body creates these antibodies and they start fighting the flu virus. You start feeling better until you no longer have the flu, right? Now, the HIV antibodies take a much longer time to be produced in the body. So the HIV antibodies may take up to 90 days or 3 months to be produced in your body. Therefore, like I stated earlier, it is required that if you do an antibody test, you go back 3 months later to do another one, because it is possible that when you do that antibody test, your body did not yet produce the HIV antibodies, and so the test results tell you that you are HIV negative when in fact you may be positive, right? So let me explain that again. The HIV virus, the antibodies to the HIV virus may take up to 90 days to be produced in the body. Once these antibodies are produced by the immune system, they start fighting the HIV virus in the body, right? So, say for example, you went to a party and, God forbid, you slept with someone, unprotected sexual intercourse. Of course, you don't know whether the person has any diseases or not, but you slept with that person and you fear that you might have contracted HIV. Now, if you go to the health center to do an HIV test, you do the rapid test or the antibody tests, say 2 weeks after that sexual encounter, then you may get a false negative report, because 2 weeks after you're infected with HIV, your body would not have produced enough antibodies to give you a positive result. So if you go 2 weeks after that encounter and do a rapid test or an antibody test, and it says you're negative, I suggest that you go back another 3 months, wait 3 more months and go back, because you need to give your body enough time to develop the antibody to the HIV virus. So say you go back 3 months later after doing that first initial test, and it tells you that you are HIV negative, then you know for sure that you're HIV negative. But if you go to do that test before that 3-month period, it may produce a false negative report, right? So for you to be sure, go and do another test 3 months later, just to make sure that there's no presence of the antibodies to the virus in your body, right? So that's where the antibody tests or the rapid tests come in, right? Because remember, I need you to remember that a person will therefore only have antibodies for a specific infection that the body has been exposed to. So if you're exposed to the flu virus, then your body will produce flu antibodies. You're exposed to syphilis, your body will produce syphilis antibodies. You're exposed to gonorrhea, your body will produce gonorrhea antibodies. If you're exposed to HIV, then your body will produce HIV antibodies. So antibodies are only produced for a specific infection that the body is exposed to. Amen? Amen. 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 Okay, so let's go back to that scenario earlier. You met someone at a party and you decided to have sexual intercourse with that person. You did not use a protection to protect yourself. No, I personally do not propagate sex outside of marriage. Biblical principles clearly prohibit sexual intercourse outside of marriage. But for the sake of HIV and AIDS, we're going to use this scenario, right? So you slept with someone, you don't know their HIV status, you've met them for the first time, you don't know what they have from what they don't have, but you have sexual intercourse, unprotected sexual intercourse with that person, which is not wise, but you did it. Now, you're concerned afterwards that you might have contracted HIV. In a scenario, in a situation like that, then you do not, what you can do immediately after that sexual encounter, if you have the money to do it, you can go to a private doctor and let the doctor know that you had that sexual encounter and you would like to do a viral load test that would test for the presence of the virus, right? So unlike the antibody test where you have to wait for 3 months for the body to produce the antibodies, the moment you become exposed to the HIV virus and you're infected, your body immediately starts producing HIV viruses, right? So once you go to do that viral load test, immediately afterwards, after that sexual encounter, then the doctor will be able to tell you, yes, we saw the presence of HIV in your blood. So the viral load tests can tell you if the virus is present in the blood. And if you believe that you have been exposed to HIV, then go immediately and ask for a viral load test. And if you are HIV positive, then the doctor will place you on medication immediately. If you're not, then give thanks and you don't do that practice again. Amen? Amen. Amen. So those are the two types of tests that are generally done, the antibody tests and the viral load tests, right? Now, there's another viral load test that is done for persons who are already HIV positive. It's called the PCR test or the polymerase chain reaction tests, right? And it's used to see if the HIV viruses are present in the blood and how to monitor if a person is responding to ARVs, to the HIV medication. So if you're taking HIV medication, then you do the PCR test to see how your body's responding to the treatments that you're taking, right? So, like I stated earlier, if you believe you're exposed to the HIV virus, then go to your doctor. Go to a doctor immediately and ask for a viral load test to be done, right? Once you have the fee, doctor's fee. If you don't have the doctor's fee, then go to the health center and ask for a rapid test or antibody test. Whatever the results are, go back another 3 months and do another antibody test just to be sure. All right? Amen, 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 amen. Okay? So, another note on antibodies, sometimes a mother, maybe a pregnant woman, may be HIV positive, right? And not because a pregnant mother is HIV positive means that her unborn child has to be HIV positive. That baby does not have to become positive, right? However, after that mother gives birth to that beautiful baby, these newborn babies don't yet develop an immune system to protect themselves from infections and viruses. So what you find is that the and that the baby uses the mother's antibody to protect itself until it can develop its own antibodies. Its immune system is developed enough to protect itself, right? So every child that is born, every newborn baby uses their mother's antibodies to protect itself until it can protect itself. Its own immune system can be developed to the point that it can protect itself, right? And that generally takes about a year and a half. So what you will find though is that if the mother is HIV positive, she will have HIV antibodies in her body, right? And so will the baby. No, not because the baby has HIV antibody in its system means that the baby is HIV positive. No, right? So if an HIV test is run on the baby to test to see if the baby is HIV positive, that test, that antibody test, will find antibodies to the HIV virus because the baby is using the mother's antibody and the mother is HIV positive, right? But that does not necessarily mean that the baby is HIV positive. I want you to understand what I'm saying. An HIV positive pregnant mother will have antibodies specific to the HIV virus in her body. After she gives birth, the newborn baby will not have yet developed its immune system to the point that their immune system can protect them. So that newborn baby will use the mother's antibody to protect itself until it develops its own, which generally takes about a year and a half, right? So if an HIV test is done on the baby, you're going to find the presence of the HIV antibodies in the baby because that baby is using the mother's antibody to protect itself and the mother is HIV positive. That does not necessarily mean that the baby is HIV positive, right? So in a case like this, then to determine the baby's status, the viral load should be measured. So the doctor can say, okay, the mother is HIV positive, and the mother has HIV antibody in her system. The baby is using the mother's antibody to protect itself until it can develop its own. So let me check for sure to see if the baby itself is HIV positive. In that case, the doctor would do a viral load test, which tests for the presence of the virus itself in the blood. And only at that point can you say for sure whether the baby is HIV positive or not. So these are the types of tests that are done and they are pain-free. I have done both tests. As a matter of fact, this year I did the ELISA test where a blood sample was drawn and I had to wait for about 2 weeks for the results and to see what is going on. And so it's painless, it's pain-free. The HIV antibody test is free. Actually, the ELISA test I did was free as well. So, depending on the country you're in and where you live, both tests may be free. It's important that you know your HIV status. If you have ever had any sexual encounter, if you've ever gotten an injection, if you've ever been in contact with anyone's blood, it's very important that you know your HIV status. So go and do your HIV tests, test yourself, test your partner to know where you are, right? If you are HIV positive, take your medication, stay on your medication, don't stop taking it. So go and get tested today. Amen.